A very warm greeting to all of you. My name is Miss Selvarani Bijji. You are welcome to Rani Bijji's video. I am extremely happy to present my second part of the video. Today I am going to familiarize you with mental health nursing and terminology used. And now in the second part, I would like to define 10 important terminologies in mental health nursing with suitable examples. I will explain some other important terminologies in the third part of my forthcoming video. First of all, let me define mental health and mental health nursing. Carl Menninger defines mental health as an adjustment of human beings to the world and to each other with a maximum of effectiveness and happiness. For example, a mentally healthy person has an ability to make adjustments. Psychiatric nursing or mental health nursing is the promotion of mental health, prevention of mental illness, and care and rehabilitation of a patient with mental illness. So, just like in physical health, nurses can promote mental health by building good relationship with patients, encouraging healthy behaviors, and recognizing and treating symptoms foremost. Psychiatry is a branch of medicine that deals with the diagnosis, treatment, and prevention of mental illness. A qualified nurse is a devoted person who shows real empathy and also has patience and sense of humor. I hope that you understood about mental health and mental health nursing. Next, you can gain an understanding of 10 terminologies in mental health nursing. Let's begin. The first terminology is amnesia. I repeat it again, amnesia. Amnesia is the partial or total failure to recall past happenings and is due to disturbances of memory. Amnesia is a general term describing memory loss. If a person has amnesia, he will have difficulty recalling facts, events, places, or specific details. For example, if I ask a person who has amnesia the following question, "What did you have for breakfast today?" His reply can be, "No idea." The second terminology is anergia. I repeat it once more, anergia. Lack of energy for day-to-day activities. For example, you may often notice tiredness and saying, "I am so tired" from such kind of people. The third terminology is ANHEDONIA. I repeat it once again, ANHEDONIA. Inability to experience pleasure in any activity. For example, an anhedonic person finds no joy from listening to music. The fourth terminology is apathy. I repeat the word once again, apathy. Lack of emotional feeling. For example, a student had lost his interest in physical life and the world after his failure. The fifth terminology is circumstantiality. I repeat, circumstantiality. A pattern of communication that is demonstrated by the speaker's inclusion of many irrelevant and unnecessary details in his speech before he is able to come to the point. Here, patient finally reaches his objective but only after many unnecessary or trivial details. For example, the doctor asks the patient, "Have you had any trouble sleeping last night?" The patient says that, "I travel quite often with my mother. Last week we went to Sweden. I really love the city. Day before yesterday, I went to bed by 10 p.m. listening to some soft music. Last night I went to bed by 10 p.m. and slept well without any sleep disturbances." The sixth terminology is delusion. I repeat it once more, delusion. A false, unshakable belief, not true to fact and not ordinarily accepted by other members' explanation. For example, in grandiose type delusion, the person may believe that he or she have a special relationship with famous persons. The seventh terminology is hallucination. I repeat the term once again, hallucination. A false sensory perception in the absence of an actual external stimulus. For example, hearing voices when no one has spoken, hearing the patient's own name being called. The eighth terminology is illusion. I repeat the term once more. Illusion. The misinterpretation of a real external sensory experience. For example, in a dark pathway, a frightened person is more likely to misunderstand a rope as that of a snake. The ninth terminology is neologism. I repeat the word one more time. Neologism. A word newly coined or an everyday word used in a special way not readily understood by others. The word selfie used as cellular-free is an example of neologism. The 10th terminology is tangentiality. I repeat the term once again. Tangentiality. A form of thinking or speech in which the client tends to wander away from the intended point and never returning to the original idea. Here, patient never reaches the goal after repeated unnecessary details. Let's see a conversation between a nurse and a patient as an example for this. The nurse asked the patient, "What is your favorite food?" The patient says that, "I first visited a Swiss restaurant in a Christmas day. Now I frequently visit this restaurant every Saturday evening with my family." Alright, so those are the 10 terminologies. Last of all, I wish to end my second session. Look at the stars in the sky that are twinkling at night. What wonderful creations they are. Nurses are providing tender care to the human beings with dedicated mind in order to enlighten the people's life like a star that shines everlastingly. A psychiatric nurse should have a realistic self-concept and should be able to recognize her own feelings, fantasies, and fears. Empathy is an important tool in understanding others' feelings. The nurse need not necessarily have to experience it, but has to be able to imagine the feelings associated with the experience. Thank you for watching. See you soon.